I'm going to put on my educator hat here so I feel comfortable in front of all of you, because this is a little intimidating for some of us. But thank you all for letting me come chat at you. So the first thing I want to talk about, just normal aging, 0 to 100, right? Obviously, when we're little, we go through rapid changes. Things happen as we get older. I don't know if anybody's noticed. Some of us have glasses now. Turns out when you turn 40, your eyesight starts to fade a little, right? Skin's one of those fun things. I came up with a bruise. I have no idea where I got it, and it took months to heal. What is that? I have a 16-year-old. She gets a bruise, and it's gone the next day. Okay, when we're 80, that doubles from when we were 30 on how long it takes to heal those. So, things to think about. What other things have you noticed as we've aged? Anybody? Anybody got any?
Work out more.
Have to work out more. Yeah.
And eat less.
And part of that skin is that gravity is kind of an issue for some of us, right? And you got to move more because our metabolism slows down. We don't need as many calories, right? So sad. I agree. I would like to have more calories. But things inside slow down, so there's things like constipation we have to worry about, and more water because we like to be dehydrated, all those kinds of things, right? So one thing I'm very passionate about is pain. And what I mean by that is I don't really like to see people in pain. Pain is not something that we normally have. So as we age, or our mother, father, sister, grandparent is having pain, especially all of a sudden, there's a problem. There's a problem. And there's people that can help you. There's a number of you here this evening that can help with that, right? Behaviors, you will hear that term if you have a family member in an assisted living, a memory care, skilled, and we'll talk more about what that means. But behaviors are a way of communicating. Just like we have dogs or infants that don't talk to us, well, supposedly, but they do because they have behaviors, right? Same thing with our older folks that may not communicate as well due to disease processes. So remember, if you're having pain, that's not normal aging. Go get some help, okay? The biggest question I get a lot is memory, right? We're all worried about not knowing who the person sitting next to us is later on tonight. That's because you had too much wine. That's not anything to do with aging, friends. So memory, if you forget things, anybody accidentally open the refrigerator to put your cereal in there because you're thinking about 6 other things, and you go, oh, just kidding, wrong cabinet. Okay, right? That's great. Now, if you put the cereal in there, close it up, and you're absolutely certain that's where it goes, now we have a problem, okay? Short-term memory loss versus forgetfulness. Forgetfulness is normal. How many of us have walked into another room and gone, what in the world was I doing? Anybody had that problem? Anybody? Nobody's had that problem. Yeah, and then you turn around and you walk back and you're like, oh, right, that's what I was doing, right? So that's forgetfulness, right? That's normal part of aging. I mean, I think it's normal part of adolescence as well. I have a 16-year-old.
That's like my 11-year-old.
Yeah, exactly. So, aging. But if we leave that room, walk into the other room, and we start something else, not at all related to our original goal, and just carry on and just forget and don't remember, yeah, that's some memory loss going on there. So those are just kind of some examples. we have a number of people that can help with all of this. And you should be the good person, the one that's there to help, but not give the bad news, right? No daughter, no sister, no brother, no mom wants to tell grandma, you're losing your mind, Gram. Sorry, right? No. Let's go see our primary care physician, right? Maybe we could need a referral to a neurologist. We're having pain because we have arthritis. All those years of skiing, turns out, does have an impact on the body. But you're healthy, you're just having some difficulties. So there's physical therapy, right? You get referrals to various different people. Dietitians. Remember I mentioned that things kind of slow down, don't need as many calories? Yeah, but which calories do you need? Does not matter if you are the daughter and you're a dietitian, or a nurse as the daughter, because mom and grandma don't care. You know nothing. Sorry, it doesn't matter what your degree is, you know nothing. So let's get the professional, not daughter, on your side, okay? Lots and lots of other people can be involved. This is a holistic process. Spirituality is a big deal. For some people, more so than others. So if your loved one is of a particular spiritual persuasion, please get their leader involved. Very important. I've had people ask, do people get more religious as they get older? No, I think it just changes. It's just a little different. So please involve all of those people in your community that mom or dad need. So in order to stay healthy through this process, what are some things that we should do? What are we doing tonight? Community, being social, eating well, right? All of the things we normally should, that's all part of what we need to do and continue to do as we age, right? Exercise. Anybody needs more sleep? Yeah, all of us. That changes over time too, right? As well as it's 70 degrees outside and grandma has a coat on. Why does grandma have a coat on? Well, that's actually pretty normal, right? We lose that fatty tissue under the skin. So it is okay. She's not going crazy, I promise. But if she starts talking about, I don't know, somebody that's walking by and gives you a great story and there's nobody there, maybe it's time to go see that primary care provider, right? Maybe it's time to talk to somebody who knows a little bit more. So I lean very heavily on our primary care providers, in case you haven't noticed. They're really important. Not all of them have a really good grasp of geriatrics. That's okay, because there are some specialists out there. So even if you have a primary care provider that knows something, you can always ask and be that advocate for mom or dad or grandma or grandpa and say, I'm really worried about whatever, their memory. And they can certainly refer you to somebody else. And at some point, when the cereal goes into the freezer and the diamond ring gets to be part of the casserole, or whatever kind of strange, unusual thing happens, it might be time to make a decision about where grandma's gonna live. So there's lots of options. And of course you have your financial advisors and you have your planners, your trust, all in place to help you, your Medicare specialists. There's a whole team of people out there that can help figure out where grandma can live. Because it's expensive, because you have provided, right, if needed. And if they can't do activities of daily living, anybody know what that means? What is activities of daily? You don't get to answer. What do we do every morning?
Grooming.
Grooming. Get up and go to the bathroom. Exactly. Roll out of bed. Getting dressed. Feed yourself. All those things, right? So maybe grandma's having some challenges there and the wrong garments are in the wrong place. So, just lost my train of thought. That's fun. Not memory care yet. I'll remember. So, as we're doing this, we're deciding where does grandma go? Does she stay home? Of course, everybody wants to stay home. Why would you want to go live anywhere else but in your own house? I have lived here 70 years. I am not leaving. You are going to drag me out of here by my feet, dead, before I leave this house. Well, that does happen, sadly. Or there's other options. There is home care options. One of the things is home health. Home health and private pay caregivers, kind of expensive. Some things are covered for home health, where you have a caregiver or a team to come in and help grandma or grandpa with their activities of daily living. Sometimes they help with cooking. Sometimes it's a social worker to come in and talk about how they're feeling, what's going on, what other resources. So it is nice to have home health. And that's not just necessarily as you age, but sometimes that's also if grandma gets a broken hip and they go home. Yes, the event that happens. And they do wind up going to their own home. Sometimes they have home health that has physical therapy coming out to see them. So that's an option, albeit a spendy one, for a long period of time. Your financial advisor can help you with figuring that out too. There's a few of those here tonight. Other options, assisted living. So my world right now is assisted living and memory care. What is assisted living? Well, that's different than nursing home. So assisted living is, so it really reminds me of dorm living, like in college. And some of the stuff that goes on in these places looks like college. Not even kidding. It's really fun. That'll be another talk some other time. So it is. You have an apartment. You get to go down for meals. You gain weight. It's great. But you need some help. So you need medication management because unfortunately, we all need some kind of medication as we age, especially for those aches and pains, even with physical therapy sometimes. Sometimes you need help with activities of daily living. Sometimes you need some help with housekeeping. So in assisted living, they provide all of that. Now, importantly, home health, you have licensed people coming out to visit you. Certified nursing assistants, nurses, social workers, PT, OT. Assisted living, you generally have maybe 1 to 2 licensed people in that community, and they're either a registered nurse or an LPN. The rest are not licensed. They are caregivers or med techs. That's different, right? They do get training, not a lot, not enough in my world, but I'm all about education. So they are there to help. The nurses help guide what happens. That's their role, and to educate. So just keep that in mind. Memory care. Memory care is the same thing as assisted living, but it's the prison, as Brandy pointed out, because it's locked. It is locked. There is no exit except out to, they do have to be able to get outside, out to an interior courtyard, fenced off area. Still have apartments. There's a lot of activities going on in the good ones. That's part of it in memory care. It's programming to keep them busy, to keep them entertained, to make sure they're not over there, I don't know, hitting somebody with their walker or trying to drag Mrs. Jones into the bedroom. Oh, there's stories. I'm not kidding, it's just like a college dorm situation. They just don't remember. Great. So memory care, oh wait, that is like college. Never mind. So memory care, also you have to have a dementia diagnosis. Now you have dementia diagnoses in assisted living and all the other places too, but you have to have it in order to be, to live in a memory care. That's the law. So the two reasons people go to memory care or need to be placed in memory care is for safety, because part of that brain change is that we like to go explore. Now, I'm all about that. The problem is we don't know how to get back home. So they'll walk out the front door of the assisted living, wander down the street to their favorite cafe that they've gone to a bazillion times, and then not have any idea where they're at all. So, which is dangerous. You've all driven in Bend. So, memory care is safe, it's locked. There's activities to keep them entertained, to keep them engaged, to make their lives better, is the point. Medication management assisted with activities of daily living, all the things. Okay? Adult foster homes. It's not like children foster homes. It's different. This is like a small, happy little assisted living, but there's only 5 rooms, 5 residents. So it's in a home. Some of them specialize in really intense care that's needed. Some want all women. Some are all veterans. So it's a very intimate world for them. And a lot of people thrive in those as well. And sometimes those with memory care that are exceptionally challenging also thrive in adult foster homes because there is only the 5 people. So just something to consider. The home, as Brandy said, nursing home. It's what, as a kid, I always thought of is where grandma was going to go to die, right? That's just where it happens. And the smell, oh, anyway, they don't smell anymore, thankfully. So higher level of care, right? We're helping people out in assisted living and memory care. Well, in the home, it usually means there's a higher level of care needed for that person. Wound care, therapies every day, PT, occupational therapy, speech therapy, etc. Maybe they're a 5 or 6 person transfer. Sometimes that's the case. Can't do that in assisted living. Sometimes it's temporary. Those are our rehab skilled nursing facilities. They kind of lump rehab and nursing home under the same umbrella. Hopefully someday that'll change, but for now it's the same. So sometimes it's temporary. It's where they go after the hospital, after the OR has fixed the hip. They go to the rehab, and then hopefully they go back to their assisted living, unless rehab didn't go well, and then maybe they just move over into the other wing of the nursing home, which is fine. Lots of good care in skilled nursing homes and just plain nursing homes. It is nurses 24/7. You have CNAs. It is licensed staff. They're governed under different entities is why you have that difference. We won't get into the politics because I need a lot more wine for that. And then last on my little list is independent living. This is where I want to go, other than living at home. But if I can't live at home, independent living. So it's like an apartment complex. It looks like an assisted living, might be part of the assisted living. You have your own apartment. You get to have meals with your friends. It is like a college dorm. You don't get any help. You have your cute little apartment, you got your car, you go out and do your thing, party till midnight, come on back. Excellent. So it's just a way to be more social, because that is a big piece as we age. We have a lot of older folks that are isolated. COVID didn't help. I don't know if anybody noticed that. But yeah, so those are your housing options for mom, dad, grandma, grandpa, whomever. All of a sudden I ran out of something to say. That'd be great. I would love a question. I could move on to another topic, but I think that's a bad idea. Go ahead.
I have a question about cost.
Ooh.
So I'm very familiar with assisted living because my mother is in it, and I know how costly that is, and she's on Medicaid. If she weren't on Medicaid, I don't know how we'd be affording it, and I'm looking at these options and wondering, I don't think there's one that's affordable, and I'm wondering, is that going to change? Is there anything out there that is affordable?
Repeat the question as best you can.
Great question. Absolutely. So the question is about cost. So having somebody on Medicaid makes it reasonable, and I'll air quote that. But if you have just enough money, how does that work, right? What's the cost? How do you do that? That's a really good question. It's not one I'm super equipped to answer. I can tell you that a lot of times with financial advisors and those in the trust world, they will help you put money away, but then there's also a spin down so that they do get onto Medicaid, which then there's only a certain number of beds. So there is a chronic problem with that. I have heard that the Medicaid rate is going up for payment a little bit. So for the community, not necessarily for the person paying. So hopefully, that sounds counterintuitive, but that should hopefully help open up some available apartments and beds. I would say talk to your Medicare, Medicaid person. They're going to know a whole lot more about that than I am. I can tell you how to take care of somebody. That's a great question. Had somebody back here? Yeah.
Yeah, so I'll tell you our experience with my husband's father, and you talked about the spin down. So that's what people really need to know.
Mm-hmm.
Is, he had whatever he had. He wound up in a hospital, then they transferred him to a nursing home, and it was Medicaid, but we had to transfer ownership of his mom and dad's house to her son, so that she showed up with 0 assets. That's what they mean by spending down. If you have anything at all in your life, like a house, a car, anything, you have to show that you have nothing. So to this day, that house is still in the son's name. And, it was just humiliating for her. It was horrible, that the only thing she had was a house. And that's what Medicaid is you can't own anything. So they made her spend everything she had. She had no cash, no nothing. And that's very humiliating at the end of life.
It is. Absolutely. So comment about spending down, and that it is real, and it's transferring of assets, so that the person going into assisted living, memory care, it shows that they have 0, which is devastating for people that have worked their entire lives, which is why you don't want to be the person to tell mom and dad that. You want your financial person or somebody else to break that bad news. But yes, thank you. It is sad. Sure.
How do you, as you have parents that are aging, how do you broach the subject of driving and bringing in their practitioners?
How do you approach the subject of driving for our aging parents? Well, if you're me, I look at mom and go, you're done. That's not the case for everybody. And generally, like anything, it's gentle. How about I come to your doctor's appointment with you? And then there's a side conversation with doc. Oh my God. Let me tell you about what mom's doing.
So is that appropriate then to make that?
It's an advocate and it's a safety issue. Absolutely. You can also ask, hey, what about an eye exam? Hey, what about, Mom, how you feeling behind the wheel?
I like disconnecting things in the car.
That's fun, disconnecting things in the car. I mean, stoves are good to do too. Take off the little dials, yeah. You know, it depends on how much you want to be involved or how much you want to get the other people involved, right? Your team of people out there. Yes,
You put a lot of emphasis on the primary care.
yes.
I'm in alternative care, and I have many patients that come to me with elder parents, so
Yes.
I hear a lot of stories. And a lot of what I hear is, because they don't have a concierge type primary care, is my primary care literally spends 5 or 10 minutes. They have a list of meds like this, they
Yep.
have a lot of issues. So, and they look to me for advice. I don't always
Absolutely.
know where to
Go.
try this,
Yeah.
try that.
Right.
I loved your idea, hey, maybe I could go to your doctor's appointment with
Yep.
you. Because often what I see is, like, for some of the elders, they don't realize there's a problem. They don't want you to go with them, and they're going and, no, everything's great. And then I get the spouse that comes in and says, oh my God, no, it's not.
Right.
So do you have any ideas, recommendations for that type of situations?
I love the alternative medicine piece.
Thank
I,
you.
I do see acupuncture and massage in these places too. My apologies for not pointing that out. But there's a lot of people out there that come to help our elders. Pet therapy also is amazing.
But the
Question.
primary care, the PCP, has such a
Right.
important role.
Yes.
And another thing, I have people frequently asking me for a recommendation. I can't find primary care.
Ooh.
And that's just part of our medical system
Yes.
here in Bend. But it's a problem, and
Yeah.
it will affect. It's
Yeah,
real.
it is.
Yeah.
I don't have a blatant answer for that, unfortunately, unless you all want to go back to
Advice.
school. That'd be great. We could all use more primary care providers, nurse practitioners, PAs, physicians in primary care, unless, seeing you have a great idea.
I just wanted to offer something.
Yes.
Other than, seeing the primary care, usually primary care is spending extra time outside of their schedule to get these people
Right.
settled. But it is a hardship on the medical system, the way it's built. But in general, other than, these very straightforward conversations about skills that they have, coordination, vision, all these things, there is a state of Oregon DMV service that evaluates for driving safety.
Oh,
And
perfect.
so families, well, usually I think that it's the physician that has to apply for it
Right.
and the reasons why. But that can be a more, evidence-based method to,